Hi, this is Ming Chu, the Injury Guru. I am the author of the book, The Permanent Pain Cure. I'm a physical therapist located here in New York City, and I specialize in soft tissue myofascial therapies, and I'm the inventor of the Ming Method. Today I want to talk about the differences between traditional massage techniques versus the Ming Method. And the Ming Method is basically a compilation of what I think is the very best in myofascial therapies, all put together, rolled up in one. So let's talk about traditional massage. There are many different forms of massage. One of the most popular forms of massage is Swedish massage. And Swedish massage, they basically do a lot of stroking techniques, plucking techniques, and tapping techniques. And it's generally not that deep, but they can get a little deep in some cases depending on the therapist. It's very relaxing, and it moves chi, if you will. That would be the Chinese explanation. I do believe in the existence of chi and moving energy. So Swedish massage can be very useful to help you relax. But there are certain things that there are strengths and weaknesses, which I'm going to talk about in a moment. And then you have aromatherapy, where they add essential oils, or you have Thai massage, which I really like, where they incorporate unique sets of stretches in between the massage, which I think is very, very useful. I've had some Thai massage and I'm impressed by it. Then there's also something called deep tissue massage, which to me is the best type of massage in my opinion, because when I go get my massages, I always prefer deep tissue massage with a person that has really, really good, precise, and strong hands. And then there's also reflexology. And reflexology is basically a person that limits their massage technique to the bottom of the foot. They believe that certain parts of the foot are associated with certain parts of other parts of your body, namely your organs, etc. So they all have value, and I believe in them. I personally get a massage roughly once every week or once every 2 weeks, and I'd probably be average between an hour to 2 hour massages, and I prefer deep tissue work, and I usually have more than one massage therapist work on me. To have a person work on me for 2 hours, it would be very difficult on the therapist, so I usually have them switch over after 1 hour. So I prefer to get two different therapists for a 2 hour massage. Anyway, what would the difference be between, let's say, deep tissue massage or regular Swedish massage versus the Ming Method, which, like I said before, is a compilation of what I think is the very best in myofascial therapies? Well, the biggest thing is the Ming Method, or true myofascial work, is designed specifically to break up adhesions. Breaking up adhesions is really, really important, because when people have pain, it usually comes from the soft tissue, meaning the myofascial tissue and the connective tissue, get filled up with adhesions. It gets filled up with granulated, densified tissue that needs to be essentially released or broken up. And the problem with traditional massage is they have a certain amount of time that they need to do the entire body, and they usually go by a routine, which is nice, but it's not as effective for breaking up adhesions. For example, I would, in a person's body where it could be a small area, it could be the size of a $50 or a little bit larger than a $50, I would routinely, personally spend at least 1, 2, 3, 4, sometimes even 5 minutes in an area that small until I was satisfied that that adhesion or that granulated tissue or the densified tissue had been resolved. And that's, to me, the biggest difference between traditional regular massage versus the Ming Method, or a true myofascial treatment where the aim is to actually break up adhesions. Very recently, they found that when you do deep tissue massage, or in my case, do very deep myofascial work, it actually increases the temperature of the body, like it's an inflammatory response. And this is very important, because they found out that roughly for every 1 degree Celsius that you increase the temperature, which is roughly almost 1.8 degrees Fahrenheit, by increasing the temperature of the tissue while you're doing the deep tissue work or the myofascial work, it actually increases the enzymatic activity of that particular area. and it also brings in healing hormones into that area that are signaling molecules for that area to repair. So why is that so important? If you checked my past posts, I talked about rethinking the use of ice. And by doing it this way, by increasing the temperature of the tissue, because with the Ming Method, for example, I can stay on one area literally for 5 minutes and really break it down and increase the temperature of that tissue. That allows the area to heal. And what happens then is by putting pressure and putting the tissue under this type of stress, by increasing the temperature, it increases what we call the fibroblasts activity. Now, what are fibroblasts? It's just a fancy way of saying these little cells that travel inside the tubules. They're like little tubes within the fascia, and it starts leaving this mucus trail. It looks very strange, but that's how it's done. And these fibroblasts will let out hyaluronic acid, collagen, and things like glucosamine and chondroitin, which are the proteoglycans. And these are the main constituents of joint tissue. So that's why myofascial work is so important. By creating this temperature change and creating this deep pressure that signals the fibroblasts to start laying down new tissue. And therein lies the main difference between getting a myofascial treatment like the Ming Method, which is a medical treatment, versus getting a massage. I think both should be employed. They're both very, very valuable. But to heal injuries, to make real changes in terms of reducing pain, say from a lower back problem or carpal tunnel syndrome or some type of knee issue, whatever the case may be, doing myofascial therapy, in my opinion, is the most efficient way of doing it. So next time, I'd like you to consider getting massage. I personally think every person should get a massage roughly every 3 weeks for the rest of their lives, and also getting a myofascial treatment like the Ming Method roughly every 6 weeks. And that way it will keep the tissue honest, and you will live a very good life, because the fascia is, at least in my opinion, 20, 25, 30% of the entire mass of the human body, and it has to be treated and treated with respect. Unfortunately, fascia and myofascial treatments haven't really been taken seriously until the last few years. It's been like the Cinderella or the ugly stepchild or the ugly duckling of tissues. But now I think with posts like I'm making today, we talk about the value of doing myofascial work and things like the Ming Method. This can also be augmented, and I'm going to be a show for my book for a second. My book, The Permanent Pain Cure, it also has a lot of spinal decompression stretches as well as fascial stretches that you can implement along with the myofascial treatments and along with the deep tissue massages that you may employ, because the stretches have also been found to activate fibroblast activities. So between that, you should be pretty healthy. Give it a try. Do the massage, do the myofascial treatments like the Ming Method. You can come here, I can show you a treatment, and do the stretches from my book, The Permanent Pain Cure. And you do all those things along with some key supplements. The supplement video I made not too long ago, you can put it all together. And this way you can be very, very healthy, and you can be your own therapist, and you may not ever need to use a doctor, or you can kind of be your own therapist and be in charge of your own health. So give it a try. Good luck. Let me know how you're feeling. So stay fascially fit. Take care.